Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid, brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
You've walked all day, you've bought a new pair of shoes, or you've just finished that long event shift, and suddenly every step hurts. So you've got a blister. Should we pop it? Today we're talking about blisters. A blister is a small pocket of fluid that forms within the upper layers of the skin. The fluid is usually clear, although sometimes it may contain blood. Blisters most commonly develop because of friction. Repeated rubbing causes the layers of skin to separate and fluid collects between them. This commonly occurs on the feet from shoes or socks, but it can also occur on the hands from tools, sporting equipment, or any repetitive activities. Other causes of blisters include heat, including burns and sunburn, moisture from sweat or wet conditions, ill-fitting footwear, skin conditions, or infections. Now, moisture plays a big role in blister formation. Wet skin becomes softer, and wet footwear often lead to blisters. So, how can we prevent them? Well-fitting footwear is one of the most important steps. Shoes that provide good support and don't rub excessively can significantly reduce the risk. Perhaps wearing in new shoes before doing that long activity. Moisture-wicking socks can also help keep feet dry. Cotton socks tend to retain moisture, increasing friction and the likelihood of blister formation. So obviously what we're saying is prevention is better than the treatment. Now, let's talk about treatment. In most cases, don't burst and pop that blister. The skin over the blister acts as a natural barrier against infection. Instead, protect the blister with a soft dressing, padding, or blister dressings that can be purchased from a supermarket or pharmacy. Even hydrocolloid dressings, which can help reduce pain and support healing. And if the blister does burst, gently wash the area with saline or just tap water. Leave the skin flap in place if possible and apply a clean dressing. Most blisters heal within a week or two. However, seek medical attention if the blister becomes infected. There is increased redness, warmth, pus or fever. The blister is very large or extremely painful. It was caused by a burn, or the patient is a diabetic or has a history of poor circulation. Because sometimes the smallest injury can become the most uncomfortable, and preventing a blister is usually much easier than treating one.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.